Hello, I'm Babitha Haridas. I'm a pediatric epileptologist in the Department of Neurology at the Johns Hopkins University. I'm joining you today to share the results of a recent paper our team published in the Journal of Child Neurology. The study looks at children with Rett syndrome and epilepsy and their response to the ketogenic diet. As you know, Rett syndrome is an X-linked dominant neurodevelopmental disorder characterized by cognitive and communicative regression, stereotypies, and loss of hand use. Epilepsy is present in 50 to 90%, with approximately one-third having refractory epilepsy. The ketogenic diet has been used as an anti-seizure therapy for over a century. However, there is limited data on its use in Rett syndrome. In our retrospective single-center case series of 9 children with Rett syndrome and epilepsy who were treated with a classic ketogenic diet, 67% had a 50% or greater improvement in seizure frequency after 6 months of being on the diet. One patient was seizure-free. In some children, there was a gradual improvement in seizure frequency as they were continued on the diet. We also observed a reduction in the number of ER visits for seizures or status epilepticus from an average of 3 visits in the 2 years preceding initiation of the diet to 2 visits in the 2 years they were on the diet for. Our data also indicates non-seizure benefits among these children. All 6 with a 50% or greater seizure reduction were also reported to have an improvement in their cognition by their caregivers. These children became more alert, interactive, and were taking fewer naps. Overall, initiation of the ketogenic diet was well tolerated in our patients, with the most common side effect being gastrointestinal symptoms such as reflux and constipation. None in our cohort developed nephrolithiasis, though they were all placed on potassium citrate. In summary, the ketogenic diet is a safe and effective form of anti-seizure therapy in children with Rett syndrome. Ours is the largest single-center case series that has been published to date, to our knowledge, with 67% having a 50% or greater seizure reduction. We strongly encourage its consideration earlier in the treatment algorithm for refractory epilepsy, especially in those with G-tubes. This work was made possible by the collective effort and support of Dr. Eric Kosoff, our keto dietitians Zahava Turner and Stacy Besson at All Children's Hospital, as well as all of our colleagues at the Johns Hopkins Epilepsy Center, and above all, our patients and their families.